we can play this.
And while you're bringing it up, I'm going to just make a mention to the fact that I do not like to treat skin type 5 and 6. Or I'm very tempted because those patients with melasma and other dyschromias can respond really, really well to fractional CO2. But the 1s and 2s and 3s, you're just not going to have any problems with them. The 4s, if I want to do a treatment on them on a scar, or usually they don't need the extent of rejuvenation because they're beautiful, protective skin that doesn't have nearly as much photoaging. So it's a different type of thing that they come in for. And so as a general rule for my skin type 4s, I might even feel a little bit comfortable with some of the peels that are out there. But if they insist, I'll do a skin test on them. And I've had a lot of skin type 4s that have done very, very well with fractional CO2 technology. I would urge you to talk to some other docs that have some more experience with skin type 5 and 6. I'm sure there's some success out there with using some, a 5% pattern and things like that. Certainly, our patients with ethnic skin deserve all that we can give them in the way of laser technology, and I think they may be a candidate for Mixto. And I have a huge African-American population base, but I see most of those patients for doing tummy work and breast work, and I don't do as much face. I don't have as many face patients that present from the African-American or Hispanic community. I can't see the video. Can anybody message him if you can actually see the video? I can't see it. And I can't hear anybody's voice.
Yeah, this is Bob. The video's playing right now. We'll go along with the presentation if it's not being projected, so you can continue if you want.
Okay, sounds great. So you guys may or may not have seen the video. You can look on YouTube under Mixto, and I'm sure you can see plenty of those scanners out there and exactly what they look like. It's pretty cool. Let's see. I am now going back to this presentation. And I'm successful here. So you can see this in the 300 spot. If you were to see the scanner in motion, the 300 is a lot faster. This is that I probably should be mixing my passes with the 180 and 300. I think that would allow me to do the superficial work a lot faster. We don't currently do that a whole lot, but as I give a presentation like this, it makes me think through what we do on a daily basis. We do a lot of mixed to fractional CO2 laser treatments. We actually have, I think, 10 or 11 lasers or energy devices in the house, including radio frequency, light, every wavelength, T-switch laser. And so what we do, our favorite laser in the entire building is the fractional CO2. And none of our other lasers generate income nearly as well as our fractional CO2 Mixto does. So you could and normally when we're doing a face, we're doing several passes of the 180, and I'll get my pointer back up here again so I can look really cool and point like you would know when I point at. So here's the 180, and it's deeper. And let's see, this doesn't say exactly what energy was used to do this, but I'll tell you a little bit about the energies that we use. They're quite high. I've only had one patient ever that had what she called the scar. Maybe I've had two, and maybe had one that I would basically. We've probably had over 150 aggressive full-face fractional CO2 treatments. Less than a handful of patients that had any effect on the natural pigmentation. And only one patient that had a little area that she considered to be a scar, but her result was so phenomenal that there was no complaint with that patient, that she had a little area that every time she put her makeup on, she kind of felt like it was a little bit of a scar. Really an excellent result. So anyway, that's what our experience is. And I guess when I turn my, there we go, perfect. Again, looking at the difference between the 300 and the 180 spots, I'm going to go on from here to the zones of coagulation. This is a really helpful slide. As you can see with the 300, you've got a lot bigger footprint, and it lays down a lot faster. So you can imagine if your footprint is smaller like this, which is the one that we usually use, it takes quite a bit longer. And there's a lot of different ways to do this. Anesthesia is obviously very, very important. For my patients, we save them the cost of general anesthesia. We use blocks. Topical is not appropriate, but blocks are. The Zimmer is. Senescence is. IV sedation is. You can do that. You don't have to do that. A lot of my colleagues do full-face treatment with the Mixto without anything but a little bit of oral medication. So as an anxiolytic, and these treatments go very well. But this is a good little, this is just to let you know, this is the one I'm pointing out right here is what we use as our workhorse. We're going across the forehead, cheeks, all the way down to the neck, into the neck. And we use this footprint right here, or maybe this, when we're doing the upper eyelids. There's something that allows you to do a few zones of energy going down the upper eyelids. And we've had amazing results with basically a laser blepharoplasty without excisions, which I hate that because I love doing excisional blepharoplasty, but patients sometimes don't want the excision. Again, a really good example looking at density. You can see going from 5% down to 40, and you can kind of see what that densities look like. And we use a lot of 40. We don't use 5 at all. We use a lot of 10, and then we use 20. Again, I'll go over my tips a little bit later. Again, like with any laser, you not only are dealing with fluence, you're dealing with what your dwell time is, or what your pulse width is. And you can just see this is the same. As you increase your power, you're going to go deeper. As you increase your pulse width, you're going to increase that zone of coagulation. Of course, you also notice that as you increase the power, even if you don't increase the pulse width, you're going to increase your zone of coagulation and necrosis. And here's just this is a real impressive part of the presentation, because you're going to look at these photos and know that these are the real deal. How many lasers have you seen where the before and after pictures were taken at different lights, and it's just kind of really, really iffy whether you're getting a result. We've had some unbelievable scar results. This kind of right-side correction isn't unusual. This isn't like, well, we treated 100 patients and we were able to pull out 3 sets of photos. This is a really, really good representation of what we expect day in and day out on our results. So the issues are everything from pigmentation improvements to even severe right eyes. Scars do better with fractional CO2 technology on the face than anything else available. You do well to combine that treatment with fillers or with some scar subcision, but it's amazing what kind of results you can get. I'm gonna break and take a sip of water and look at the last IM that I had that came in. And someone asked what my conversion rate fractional CO2. Well, the name of the game isn't fractional CO2. I don't sell fractional CO2. I sell a better face. And I talk to patients about what it is that's going to make them happy. I use the illustration that I don't like to deal with singles and doubles. If a technology isn't going to deliver to me a triple or a home run, I don't really want to mess with it. I can accept a single if the patient can accept that result, and maybe they're so risk intolerant that they won't let me give them